I've been in this practice 13 years, and I have an ambulatory, an outpatient family medicine clinic, and it's mostly adult medicine. A lot of complicated patients with diabetes, hypertension, cholesterol issues, strokes, and heart attacks. So my patients traditionally are on multiple medications. Right before GenoPATH started at my office, I was struggling with one of my older patients with uncontrolled hypertension. And we were just going up and up and up on his medicine and seeing really no results. And it was baffling, and adding other medications, and it was just really frustrating to him and to me. And we did the GenoPATH testing. He was one of the first that we did, and his results showed that he had absolutely very little metabolism for the particular drug I was aggressively adjusting. But it suggested an alternative in that class, and when I switched to the alternative, his blood pressure responded perfectly. So it was a cheaper medication for him and a much lower dose. And it also explained what was wrong. That made me a real fan of this testing and the technology that comes with it, and the information that we can learn about patient pathways. It uncovers the mystery of why medicines work and they don't work in some people. And before, we've just, now I realize, gosh, we were just throwing things at people with indications of treatment, but really not understanding if they were going to benefit from this medicine or not. It's so much of medicine is trial and error, really. And now we can predict which medication is going to work firsthand, or at least take people off medicines that aren't benefiting them and switch them to something that's way more beneficial. And sometimes we have a cost savings as well, so that's so beneficial for the patient. This day and age of electronic medicine and all of the changes the government really has required in medicine, we are strapped for personnel, and we're all working, doing so many more tasks each day than previously. One reason I was intimidated to initiate this testing process is because I thought it would be labor intensive on my staff. They offered to have a tech in my office to perform the test and do all the paperwork and mail the test to the company and just take care of giving me the results and helping me interpret the results initially. And that was very helpful. It's difficult to try to incorporate any kind of new testing or procedures in your office if you run a staff like mine. So when the company actually offered to have a tech with me 2 days a week, that was just huge. And so now I'm able to do it, and it's effortless really on my part. I think in general it's given me a lot of information that's helped me change and tailor patient medication to be most effective for that patient. And this company is very supportive and really helpful in integrating this new technology in a very seamless way into your practice. They provide the manpower, they provide all the technical help you need. All you have to do is provide the patients. Reports are super easy to read now and interpret, and the patients are really interested. They want to know the results of their DNA test. They love having a card in their wallet that gives them their DNA results. And it's going to benefit any future physician, any other clinician that's trying to treat this patient. They will have the benefit of this forever. And they can choose and tailor future therapies to most benefit their patients. So I think it's super helpful.